Good morning, my name is Mayleen Mercado. I am a nursing student and I'm going to be irrigating a nasogastric tubing today. So the first thing I want to do is I want to check my provider's orders. I want to make sure that I assemble all my equipment. So I have my irrigation tray, my syringe. I'm going to make sure that I put my name, the date, and the time. It has to be replaced every 24 hours. I have my normal saline as ordered by the doctor. So I'm going to just pour my 20 cc's of normal saline in my container. So I have that ready. Now I'm going to walk into the patient's room with my doctor's orders, and I want to make sure that I have ID'd the patient. So this is my patient. I'm going to briefly explain the procedure to my patient, and once I do that, I'm going to raise the bed to a comfortable working position so that I don't strain my back.
Hi, my name is Christine and I'm doing a validation now I came into the room. I checked the doctor's orders.
Okay, and I'm going to just raise the head of the bed to a 30-degree angle. Okay, I'm going to just bring this down so that I can inspect the nose area. I want to make sure there's no redness, there is no inflammation, and I want to make sure that there's no possible dislodgement of the tubing, so there isn't. Okay, I'm going to bring this back up. I'm going to wash my hands. I'm going to put on my gloves. If I drop that, I would get a brand new pair of gloves.
Now I also wash
but
my hands
for validation purposes, I did get a pair of brand new gloves. I didn't want to make believe you guys didn't see that, sorry. Okay, but I have a fresh brand new pair of gloves. Okay, so I'm going to continue. Now that I have everything, I'm going to bring this down. I'm going to turn off the machine. I'm going to get my 20 cc's of air, my 10 to 20 cc's of air ready in my syringe. I'm going to kick the tubing. I'm going to take this off. I'm going to put it on top of a towel. Okay, it's on top of the towel. Okay, just bring this on for a second. Get my alcohol swab.
Now I hear bowel sounds, so that's a really good thing. Now I'm shouting it. So I'm going to put my gloves on before I do anything. And also I'm going to turn the
just
pump
want to
off.
clean my stethoscope.
Now my gloves.
That's clean.
Gloves.
Okay, I'm going to go to the left of the tip of the xiphoid process. And while I'm listening for the swish sounds, I'm going to gently aspirate the air while listening. Okay, just bring this, take this off.
Put on a towel.
Okay, now I'm going to take 5 to 10 cc's of the gastro contents.
Now this is connected to the feeding tube.
Take that, take this off.
Take it off.
I'm going to have my gastro alcohol test strip with a litmus paper. I'm going to put a little bit to test the pH. If the pH is less than 4, we would discontinue the feeding and we would notify the healthcare provider. But in this case, the pH is above 4, so I can continue. So now that I do that, I'm going to put in back the gastro contents into the patient slowly. Okay, take that. I'm going to grab from my normal saline, I'm going to grab 20 cc's or as doctor's orders. So let's make believe that I grab that.
Normally if I got out 100 cc's, I would have to just take it out. And
I'm going to gently insert it into the patient.
In this case, it's only 20.
I'm going to lower my syringe. If it was a bulb, it will aspirate back all my contents, but since this is a syringe, I'm going to gently aspirate back as much as comes out. So I'm going to know for any color, any odor, any particles, and the amount so that I can record that in my notes. Once I see that there's no blood, there isn't anything, I can continue with my irrigation. So I'm going to put it back into the patient. Okay. I'm going to keep that, put this on top of my towel, and I'm going to just grab my tubing. I'm going to connect that, being gentle not to remove the actual tubing over my patient. Break this up. I'm going to lower the bed to the lowest position, but I'm going to keep the patient's headrest to that same degree angle, which is 30. Make sure there's no aspiration. Patient's all the way down. I'm going to clean my syringe. I'm going to put it back into the container for, in order for us to reuse it again for the patient. It should be changed any 24 hours. Once I clean that, I'm going to take off my gloves. I'm going to wash my hands, and I'm going to record the input and output in my nursing notes. That was my video, and that's how you irrigate a nasogastric tubing, and thank you so much for watching.